Hello, hello. Today I'm going to be talking about angular cheilitis, and this is going to be a part of my Lip Lesion Series. It is also known as Perlici or angular stomatitis, and it is defined as an inflammatory condition that affects the corners of the mouth. It can affect up to 20% of the older population. And even though it's a common condition that can affect people of all ages, it is more prevalent in older individuals or people with chronic health conditions such as diabetes or HIV/AIDS. But it can also occur in infants and young children due to thumb sucking and the use of pacifiers. Its etiology is linked to Candida albicans infections, nutritional deficiencies, mechanical factors, loss of vertical dimension, and Staphylococcus aureus and Streptococcus species. Clinically, we're going to see erythema, fissuring, and maceration at the corners of the mouth. The patient is going to complain of this pain, burning, or itching sensation with a difficulty opening the mouth or even smiling. Also, we're going to be able to see some crusting and scaling. But why did this happen? So, the pathogenesis of angular cheilitis involves a complex interplay between microbial overgrowth, salivary pooling, and mechanical irritation. What happens is that the corners of the mouth become macerated due to saliva accumulation, and this is going to create an ideal environment for fungal and bacterial proliferation. This will lead to inflammation, fissuring, and the characteristic erythema and crusting. And even though the diagnosis of angular cheilitis is primarily based on the clinical presentation, in some cases we will need to make a smear of the area to confirm the presence of Candida or bacterial infection, especially in those recurrent cases. Once we know what we have in front of us, we could either recommend topical antifungal agents, topical antibacterial agents. They use some barrier creams. But did you knew But did you know that nutritional deficiencies could play a huge role in angular cheilitis? For example, a vitamin B complex deficiency, especially B2 and B3, can lead to fissuring, inflammation, and poor wound healing. Vitamin A is gonna lead to dry, scaly skin and poor barrier protection. A vitamin C deficiency is gonna impair healing, and zinc deficiency is going to impair skin regeneration. Lastly, by correcting the predisposing factors, when we address vertical dimension loss, we can alter lip posture. Restorative treatments, such as dental prosthetics or occlusal adjustments, can also help to reduce this risk and promote healthier lips. The prognosis is usually good, especially if the underlying predisposing factors are addressed. And now let's talk about some differential diagnosis. We could have cold sores, contact dermatitis, and atopic dermatitis. And here I made this cute comparison chart where we're going to see angular cheilitis versus those three differential diagnoses. So, what are the common questions that we may have regarding angular cheilitis? So, what are some atypical manifestations of angular cheilitis that might surprise us? Even though it is typically bilateral, angular cheilitis might have an unilateral presentation, uh, some minimal redness, and it could spread beyond the commissures. In severe cases, this inflammation is going to extend beyond the corners of the mouth and is going to involve the adjacent skin and lips or even the face. Another question that we may have is how can we effectively differentiate angular cheilitis caused by a fungal infection from that one caused by a bacterial infection or other factors? One, the clinical appearance. Those that are associated with Candida often have like this whitish or creamy appearance. Bacterial infections, on the other hand, may show more like a yellow color, crusting, or even pus. The patient history is another thing that we think we need to consider. We need to ask about the predisposing factors like the use of dentures, the use of recent antibiotics, or some systemic conditions such as diabetes. And lastly, microscopic examination. A swab of the lesion is going to help us identify the presence of Candida or bacteria. And the last question: how can we best consult patients about lifestyle modifications to prevent angular cheilitis? 1. To maintain good lip hygiene by gently cleanse the corners of the mouth and keep them well moisturized. 2. By avoid licking lips. That saliva evaporation exacerbates dryness and irritation. 3. To manage systemic conditions such as control of diabetes, addressing nutritional deficiencies, and seek treatment for any underlying condition. And lastly, we need to guide them to choose lip products wisely. We need to teach them that they need to avoid irritants and allergens in lip balms and cosmetics. If you like this information and you find it useful, please love it, comment, share, and save it. Bye bye.